Well, welcome everyone. My name is Dr. Lindsay. I am going to be your speaker this evening. Welcome to the Animal Care Center and Utah Dog Parks Client Education Series. So each month we meet on typically the first Tuesday of the month and talk about some really interesting topics within canine medicine, training, all sorts of different hot topics and things. Today we're going to be talking about a topic that I'm particularly interested in, canine cancer. So who hears the word cancer and their mind just freezes and they just panic? Anyone? Yeah, that used to be me. I mean, even when I first started practicing, you would get a diagnosis that was cancer and your brain just said, oh my goodness. But now, you know, I respect that word, I respect the C word, but I'm not scared of it anymore. And we're gonna kind of go over why I'm not so scared about it, and then some different topics within canine cancer so we can understand it a little bit better. So just a little bit about me. So my name's Lindsay Wright. I'm an associate veterinarian and the medical director for the Animal Care Center and Animal Care Center Airport. I graduated from Purdue University, so if you see my laptop and things, I'm a big Boiler fan. For the first few years right outside of vet school, I was an Army veterinarian, so I got to travel all over the world taking care of military working dogs and soldiers' pets, and it was really, really fun. But I'm glad I ended up in Utah and met Dr. Pam. I am married to this really handsome gentleman named Jake, and this is my senior shepherd mix named Gibson, and he's a really big reason why I'm so interested in this topic, because I have a senior pet at home. I worry about the C word every day. If he looks at me funny, I'm saying, what's wrong with you? You know, bud, we need to get over here and reassess. We like to do all sorts of different things. This is just a fun hike we went on over the 4th of July. Up in the Uintas, we went to Red Castle, and it was amazing. So today what we're going to talk about, we're just going to start to break down canine cancer a little bit more. We're going to go over some warning signs that your pet may have cancer. We're going to talk about some things that may predispose your pet to having cancer. We're going to talk about how do we screen, how do we find cancer, what are some really common types of cancer, and then how do we beat it? Because sometimes we can. And that's the fun part. So first part of why this is important. So canine cancer is the leading disease cause of death in our canine patients every year. Over 6 million dogs are going to be diagnosed with cancer this year. 1 in 4 dogs will at some point develop cancer in their life. If you have a dog over 10, who has a dog over 10? Half of you, your dog will be diagnosed with cancer. And there's a lot of different types of cancer out there. There's over 100 different types of cancer, just like in human cancers. But not all cancer is created equal. There are very aggressive and scary types of cancer, and then there are some not so scary kinds that we can actually beat. When caught early, many cancers can be cured or managed for really long periods of time, and I'm going to tell you about a few cases of mine that I diagnosed with cancer at my very first few days at the Animal Care Center that are still doing great. And then lastly, there are new treatments that are available each and every day. This is one of the top areas of research in veterinary medicine is canine cancer research. So never worry, there is always a new treatment opportunity or a new trial that's available for your pet if current things aren't working. So the first thing that I wanted to do before we really got into the nitty-gritty of cancer is talk about a few terms, kind of break down in real language what do those mean. Because a lot of times people will say, that's a malignant cancer. What does that mean? Okay, when I think of malignant, I think of an aggressive type of cancer. So this is a type of cancer that's really invasive. It wants to go to other spots and travel to other areas within the body. And then there are types of cancer that are benign. These are our less aggressive cancers that don't tend to go to other places in the body. They tend to stay right where they are, and that's that. And then we have that really, really scary group of cancers that are called metastatic cancers. And that means it's already other places, so it's in different areas of the body. And then finally, the term staging, because I'm going to talk about this a lot when we go through our common types of cancer. So staging is a process of a few different types of diagnostics, and it depends based on what your pet's cancer is, what that test system looks like, but it just helps us to know how extensive is the cancer so we know how best to beat it. And one of the cancers that we're really going to talk a lot more about this is lymphoma. Has anyone heard of lymphoma before? So warning signs, what do you look out for? What does cancer look like? And the hard answer to that is cancer does whatever it wants. It looks like anything. It can be a dog that is usually a voracious eater, suddenly going off food and not eating. You know, I think of one of the Labradors suddenly not eating. That makes my heart pound, and that makes me say, hey, something's wrong. We need to start looking. Any abnormal swellings, whether that's of a leg, whether that belly is looking a little bit more round or swollen, or even if there's an area of skin that's changed a lot. And then sores that don't heal. So say maybe there's a spot on the skin that's just not going away, or maybe it's getting a little bit bigger or looking more red or irritated. Those are things that start to make my mind a little bit more nervous. Weight loss. Weight loss is actually one of the biggest things that I see with canine cancer because dogs are stoic. They don't tell us a lot of times when they hurt. They are really good at hiding their disease until they just absolutely can't anymore. And you start to see changes in their appetite, changes in their weight, changes in their attitude. Loss of appetite. So that dog that normally loves food, or maybe a dog even that's chewing a little bit differently, we're going to look in that mouth and we're going to see if there's anything going on in there. Bleeding or any type of discharge that's outside of the ordinary. So say we have a kiddo that's got some green boogies coming out of the nose. We're going to start to think about taking a look in that nostril and see if there's anything there. Hopefully it's just a foxtail. We're in Utah, but we always want to be prepared for worst case scenario. An unpleasant or unusual odor. This is something that's pretty common, especially within mouths. So we'll notice people say, you know, I don't see anything in the teeth. The teeth look okay, but there's a really, really nasty odor to the breath. And then you can take a look further back in the mouth and maybe see that there's something happening. So there's a little tumor that's forming, things along those lines. Difficulty eating or swallowing. A loss of energy. And then if you notice, especially, this is for my big dog people, it can happen to anybody, but if you're noticing any lamenesses where suddenly a dog is favoring and not putting as much weight on a specific leg, or if they're limping very suddenly. And then lastly, some changing in normal bodily behaviors. So normal breathing, abnormal breathing, where maybe they're panting more than usual, or they're taking a different type of breath that's outside of the ordinary, or you notice changes in their urination or defecation habits. So straining, things along those lines. Any questions about warning signs? Has anyone's pet ever had any of these signs? These are pretty common clinical signs for a lot of different diseases, and I think that's the really interesting part of cancer is it looks however it wants. In every cancer, so two dogs can have the exact same cancer and totally different clinical signs, and I think that's the biggest thing that I tell owners is, you know, that's when we start to say, okay, something's wrong, now we got to run some tests, and we're going to talk about those tests. So screening methods. So here's Dr. Kara doing a screening exam on one of our airport police dogs. That is physical exam. So one of the biggest things is physical exams. So my husband laughs at me like crazy, but I am very persistent. Every month while I'm doing my dog's heartworm and things like that, I'm always feeling him over because he's 10. You know, he's got lumps and bumps all over his body. So I'm looking and I'm checking, does he have any new ones? How's his belly feel? Does his color look good? Because his mom's a vet, so that's what he gets, but he likes it. So regular physical exams. So with my dogs that are less than 7, typically once a year is fine unless there's any medical issues. With my senior pets, we're actually recommending that they come in at least every 6 months for physical exams to monitor for new lumps, make sure things are going well at home, because the best part about cancer is the sooner you find it, the sooner you can try to fight it. So the question was, what about blood work for an older dog? And that question is a really pet-specific answer. So I'm a huge advocate for, at minimal, in a senior pet, a CBC, a chemistry, most likely a thyroid and a urinalysis every year. But if that pet has any concurrent diseases, so maybe they have an elevation or an abnormality that's kind of borderline, that may be even more frequent. It could be every 3 to 6 months, just depending. So my dog is a liver dog, so he's always has these chronic liver enzyme elevations. So I do his blood work every 6 months, and that's how I screen and make sure that his disease isn't changing. So lab work, and it's never too early to start lab work. I love these dogs that have had blood work at 2, at 3, because then what we can do is we can monitor trends over time. This is one of my favorite things to do for kidney disease, so I will try to keep myself kind of at a minimum. I have a really huge passion for kidney disease, but one of the things that we can look out for is elevations in that blood work. So you can look for those numbers starting to climb over the years. And once you recognize that climb, the earlier you start intervention, the better the outcome for that pet. So whether it's diet, whether it's liver protectants, things along those lines. There's a lot of different options out there for monitoring and more preventative care that we can do for these pets. Radiographs. So radiographs I recommend in my senior pets. It's very owner dependent as well, but at... Dr.
Lindsay, can you tell us what radiographs are?
Radiographs, so x-rays. We're going to take some pictures. So we're going to take some x-rays, look at different areas of the body. So with radiographs or x-rays, we're typically taking those in our senior pets for a variety of different reasons. So one of the biggest reasons is osteoarthritis monitoring. I look at my dog's chest every year, and I make sure that his heart and his lungs look normal. And then I'm always also looking in his belly to see if there's anything that's outside of the ordinary with any of his organ systems. And then abdominal ultrasound is a very common also screening method for our senior pets, particularly if they have any abnormalities on their lab work. So to actually take an ultrasound and look at each organ individually to make sure that we're not seeing the formation of a small nodule or anything along those lines, because a lot of those we can actually take a little needle and we can get a sample of it and we can send it to the pathologist and he can tell us how worried we need to be about that. And then you kind of get into these more advanced screening type methods, so CT and MRI. Those are not as commonly used as preventative screening measures, more if you're concerned that there is a problem, but we're not finding it on our other imaging. So it just gives us a different way of looking at the body. And then one of the biggest ones, and we're going to go into this in a little bit more detail, is what is called a fine needle aspirate or a biopsy. So this is for all those bumps. So who's got an old dog with bumps? There's got to be some people here. All right. So one of the, I think, the most interesting things of senior pet ownership is trying to discern, how worried do I need to be about that lump? So we're going to talk about that. So lumps and bumps. So anytime your pet has a lump that is bigger than the size of a pea, or if it's been there more than a month, we recommend aspirating it. The caveat to this being, if your dog has a pink bump or something really that showed up super quick and looks really irritated, don't wait a month. Come on in and see us and we'll make sure it's nothing worrisome. But this is kind of for those smaller lumps that form underneath the skin and things over time. I really love this. This is actually something, I went to a fun CE conference this July, and I started doing this for my dog because he has a lot of them. He has about 10. So, and I'm like, have I checked that one yet? I can't remember. So I've started actually mapping a lot of my bumps on dogs. And this is something that we can keep in your file. You can keep a copy for at home. And what you can do is you can draw on the little picture of the dog, where is the lump? And when did it first show up? And then 2, she even had some really fun notes, aspirated lipoma. And so that way we know these are the bumps that we've checked out. these are the bumps that we haven't, so that way we kind of know what we need to be looking out for. And then the biggest part of why we like to check these lumps is just to be proactive, to know what is that lump. And then if it is something that we think we need to remove, we can go about the best surgical plan to remove that lump as possible, because the first time you ever take a bump off, that's my very best chance as a veterinarian to cure that dog of its cancer and to remove that lump completely. So you want to know the most about that lump as possible, so that way when I go in there, I have a really high chance of success of taking the whole thing. Any little questions? And I can get anyone who wants this little chart, I can email it to you at the end of the presentation. I love it, love it.
Dr. Lindsay, can you tell us about aspiration? Or what that is?
Yeah. So aspiration of lumps is really quite easy. So I'm going to borrow a little dog right now. All right. Dee, you need to come here. I know. All right. She doesn't have any lumps because she's just a little tiny baby. So aspirates can be done on an awake animal in most pets. They typically don't need any sedation or pain management before an aspirate. All we do is we take a very, very small gauge needle and we hold the lump and take the needle just very gently and get a little sampling of the cells. Typically, the dogs don't even know that anything's happening. And then afterwards, sometimes the skin can have a little bit of a skin ooze, and then we just put a little pressure, clean her right up, and she's done. She doesn't even know that she's had a really major diagnostic test that's so helpful for veterinary practitioners, but it didn't bother her one bit. This is a little different than biopsy. So biopsy is done a little bit differently. Biopsy is typically done under sedation or local anesthesia, and in some cases general anesthesia if we are thinking about doing what's called an excisional biopsy, where we try to take the whole lump out. A lot of times we're doing that while the pet's completely asleep, so that way they don't feel any of the things that are happening, because that actually is a little bit more invasive. This is the really interesting part to me. So what predisposes pets to developing cancer? What are the things that we know have a link to canine cancer? And then what are some other things that maybe we don't know yet? This is a really, really common area of veterinary research. There's actually a fantastic group called the Morris Animal Foundation that they realized that golden retrievers have a higher incidence of cancer of almost any other breed, and they wanted to find out why. So they're studying a whole group of Goldens throughout their whole life to try to find out, why does this amazing breed get cancer? And it's so interesting because they're just starting to publish their results, and they're starting to find some genetic links on why these pets have cancer. And then once we know the genetic link, then they're going to make a test. Then we can screen these dogs, and then we can help to fight canine cancer even more. So one of the biggest ones, and I think one of the most challenging things for me in veterinary medicine, is obesity. So obesity is very prevalent in our canine and feline patients. Typically over 66% of the patients I see every day are overweight or obese. And fat is really inflammatory, and there are many types of canine cancer that have an increased risk of incidence, which means it's going to happen more to those pets that are overweight. One of the biggest ones in our female dogs is mammary tumors. There's a really high correlation of, if you have a middle-aged female and she's overweight, her chance of cancer is a lot higher than that if she was a healthy weight.
Oh, wow.
I know.
That's interesting.
Yeah. Yeah. The next one is reproductive status. So whether or not your pet has been spayed or neutered. And then also the timing of when your pet is spayed or neutered. And we're going to touch on this again in that mammary section. But our intact male dogs, so our boys, have an increased risk of prostatic cancer, testicular cancer than our neutered males. And our females that are intact, so maybe we have a breeding female, things like that, they have a lot higher risk of mammary cancer than a female that has never went through a heat cycle and was spayed at a young age. And the reason why we're going to go through this is really what I want to do is, we have those pets that stay intact because they're going to have babies and things like that. But what it can help to do for you as a pet owner is educate you. what are the things that I need to look out for in my dog? Which of these are applicable to my dog, so that way when I'm screening them and I'm checking to make sure that everything's fine, I know what to look out for. So if I have a female that's had a few litters, I'm going to do regular breast exams on her. I know that feels really awkward to say, but it's something that we do each and every day. Breed. I think that this is one of the biggest ones that we think about in our dogs. Is there are certain breeds, I kind of mentioned the golden retriever, but we have those classic breeds and those classic sizes of dogs that are more at risk for developing certain cancers. I think of Rottweilers and I think of osteosarcoma, and that's the first thing I think of if I have a 6-year-old Rottweiler that comes into me for limping. You know, it's just that higher on my list because there's a breed correlation. Some of these we know there's a certain gene that predisposes them, other ones we don't. That's an area where I hope with future research we can figure that out. Sun exposure, this is a really, really big one for skin bumps. So for certain types of skin bumps, sun exposure puts these dogs at an increased risk. So maybe you are an avid hiker that has a white boxer that loves to run outside all the time. That is a dog I'm going to watch really, really closely for skin lumps and bumps, because we're going to talk about a certain type of cancer where that sun exposure puts them at a higher risk. And us just living in Utah immediately puts us at a higher risk because we're at a higher altitude. And then the last two kind of fall in line together. So previous chemotherapies and radiations, and then immunosuppressive medications. So when pets are undergoing chemotherapy for a different type of cancer or radiation for a different type of cancer, or take immunosuppressive medications like prednisone for really severe allergies, GI disease, autoimmune disease, those dogs are at risk because their immune system is down. When their immune system comes across a cancerous cell, they're going to be less likely to recognize that as abnormal and giving that cell a chance to actually start dividing and replicating and actually cause cancer.
Has there been any studies that predisposing factors on like long-term stress? When these show dogs undergo a lot of stress, do they, in their immune systems are lowered, do they have a propensity to later on get cancer?
Not ones necessarily that I've read that have been correlated to stress, but there was a really interesting paper that I read within the last 2 months that's starting to correlate young infectious diseases in our canines, particularly parvovirus, with GI lymphoma later in life. So infectious diseases, yes, but the stress, I mean, as a provider, it makes, and as a scientist, I think it makes sense to me that a lifetime of stress, or those dogs that are more anxious that tend to make all these antioxidants and things, I think it makes sense, but I don't know of a medical paper that documents that. Steph, Verona, Lauren, anybody? Okay. And also we have 3 other great veterinarians in this building, so at any point if they have any thoughts, they're just going to chime in. Any other questions about predisposing factors for canine cancer? Okay. All right. So now we're going to start talking about 5 of the most common types of canine cancer that we see all the time. And unfortunately, I've actually seen quite a few of these within the last 2 weeks, so they're pretty fresh and pretty raw. So lymphoma is actually the most common. So lymphoma is a disease that affects what is called lymphocyte, which is a specific type of white blood cell that's typically more commonly associated with responding to different types of infections and things along those lines, and immune system. This is a really diverse group of cancer. There's over 30 different types of canine lymphoma that have been documented, which is difficult because it makes every little type of canine lymphoma is managed very differently, it presents very differently, so canine lymphoma is very patient specific. This is one of those cancers where the staging process is actually really, really important. So this can go anywhere in the body. The main organs that it tends to affect are the lymph nodes. The biggest ones that I have owners, so similar to this guy, little arrow is pointing, so that is a swollen lymph node under the chin of a Weimaraner. That's one of the biggest things. The owners will come in and say, my dog has a swollen neck or a swollen chin. It can go to other areas of the body, the spleen, the liver, the bone marrow, the kidneys. It can really go anywhere that it wants in the body. It varies based on the type of cancer. When I'm kind of counseling owners, if we get the diagnosis of lymphoma, if you have to have cancer, I want to have lymphoma because this is the cancer that we know the very most about, and we have the most treatment options. And we have treatment options that put these dogs into remission. So we're talking, at that point the cancer is gone for not just days, not just weeks, but years. One of my very first patients that I met at the Animal Care Center, her name's Maisie. In my first week, I diagnosed her with lymphoma. She had swollen lymph nodes all over her body. She started chemotherapy down at ACC, and 3 years later, she is still cancer-free, which is incredible. So I think a lot of people hear the word lymphoma, but they get really scared. But we have a lot of treatment options, and it's so variable based on the type of lymphoma your pet has, based on where the lymphoma is at, what are your personal beliefs about chemotherapy, and we're going to break down some of the myths of chemotherapy at the very end of the presentation, but we have a lot of options out there. How is it diagnosed? So typically it's diagnosed with fine needle aspirate or biopsy. So taking a little needle, getting a sample of those cells, looking at them underneath the microscope, or taking a sample of that tissue, sending it to the pathologist and having them read it. And then treatment options, there are many. So there is a whole, the section of the cancer textbooks, the section for lymphoma is one of the fattest chapters in the whole book because there are so many different options. The gold standard right now is a four medication treatment protocol that takes a few months to treat. Some of these are oral meds, some of these are injections, but these dogs do phenomenal. Any questions? And we're just kind of going to break down the nitty-gritty of these cancers, and we can go over any specifics if you guys have questions. Okay, mast cell. All right. Who's got a pug or a Boston or a boxer? Mast cell disease. This is the most common type of skin lump that's going to form on our dogs, so actually within the skin layer. So these typically arise on the skin. They can go to other organs. That's not quite as common. They can go to the spleen. They can go to the liver. But usually what they are is they pop up as a little pink bump on the skin. Usually it's pretty angry. Some dogs will just love to itch and scratch at them because they're really itchy. The reason why these are so red and irritated is they actually come from an immune cell that's typically associated with allergic reactions. So it's called a mast cell. And certain breeds, so I kind of said a few of them, are predisposed. So our Bostons, our boxers, our pugs, our bulldogs. I should have said bulldogs. I'd probably maybe get one person. No? Okay, still no. So how is this diagnosed? So typically with a fine needle aspirate. So taking a little needle, get a sample of those cells, looking at it underneath the microscope. Again, not all mast cells are created equal. We have these really easy ones that I love. You take them off, they're gone, you never worry about it, you just monitor for new lumps and bumps. There's a different type of mast cell that's a little bit more aggressive that you take it off, and then some of those dogs would benefit from chemotherapy afterwards. So if it's a more aggressive type of mast cell. So breast cancer or mammary cancer. So this is a really common type of cancer within our female dogs. It happens to boys too. One of my very first breast cancers was a male Bengal cat, but it's most common in our middle-aged females. And it's more common in our females that were not spayed at a young age. So maybe they've went through a heat cycle or two. This is one of those where your pet's risk increases as your pet goes through heat cycles, and it increases exponentially. So each time they go through a heat cycle, their risk is much higher than it was before, sometimes as high as 8 times as likely as if they were spayed at a young age before they went through a heat cycle. So this will affect 2 in 1,000 dogs, and this is typically diagnosed with aspirate or biopsy. And just like all cancer, it is not created equal. It's very similar to human breast cancer. Typically, we're removing these. And based on how large the mass is, where the mass is, helps us to decide how do we take it off. I've had dogs where I've actually removed and done what's called a double mastectomy. So I've removed both sides of the breast tissue all the way from their chest down to their bottom. So those are the more aggressive types, and if you're really trying to go for surgical cure. But then there are other little breast lumps that are quite small that you can do a lumpectomy, and those dogs do fantastic. And surgery is typically curative. And many times if your pet is still intact, we will also recommend spaying at that time, because the more they go through heat cycles, the more their risk continues to increase.
Does the risk decrease with pregnancy?
Let me have you repeat it real quick.
Does the risk decrease with pregnancy?
So unfortunately, no. So the unfortunate part of breast cancer is it's estrogen dependent. So as pets go through heat cycles and maintain pregnancies and things, they continue to have the same risks. Okay. Any other questions? This is a really kind of hot topic one.
Just wanted to
Yeah.
quickly, she just went for her she's got little teats. So will they stay that way, and is that a problem?
So the question was, so our cute little volunteer from earlier, so she just went through her very first heat cycle. She has relatively a smaller juvenile mammary chain where it's still, the nipples and things are still small. Will that cause her any problems? So as she continues to go through heat cycles, her mammary chain and her vulva will become more developed and more prominent. And then during her cycle, you can actually notice some mammary development to the point where maybe you can even feel the mammary tissue. And so with my females that have went through heat cycles, I recommend just routine breast exams. We do it for ourselves as women. We recommend it for our dogs as well. So just regularly checking the breast tissue for anything that feels outside of the ordinary. It can feel like a little pea stuck under the skin to I've taken off masses that were this big on the mammary chain. I mean, some really big lumps. And if you see or notice something that's outside of the ordinary, the smaller it is, the easier it is for cure for mammaries. They have a better odds of being a benign mass when the mass is small. And then the other thing too, I always tell dogs, so women are really quite lucky. We know where our mammary chain is. In dogs, it's actually a lot longer than it is than what many people think. So the mammary chain goes from almost underneath the armpits all the way down to the groin area. So you actually have to be checking quite a bit of area to make sure you're not missing a lump.
Once she's spayed, will that all go back to
Not typically. So sometimes no. So if she's in heat, it'll shrink down to a more normal size following the heat cycle, but she can always look more developed.
So what if it doesn't shrink back down to normal? Does it always, or?
It should. Yeah. After a heat cycle, the prominency should go down, and it can take some time, sometimes up to a month, but it should go down. Okay. Any other questions? A really kind of hot topic for veterinarians for this is, so when do I spay and when do I neuter? And this is something that, again, that's a very personal decision between an owner, a veterinarian, and a pet. Because a pet that's a giant Great Dane, I don't want to spay them at 6 months. Their joints are still developing, and they're still going to be developing for quite a long time. So I'm going to chat with that owner, and we're going to talk about those risks, and we're going to decide together when is the best time for spay for that pet, because there is no right or wrong answer. I think it's all about understanding risk and then knowing what you're getting into.
One more question, I'm sorry.
Yeah.
So,
No, this is I love this topic.
okay. So she's teeny tiny. So
Yeah.
are you saying that so it's based on size and not on age as far as their bone development, their everything closing, their real bones?
Yeah, so, and this is going to be, oh, yeah. And Steph, come up here and we'll kind of like play devil's advocate off of each other, because I think this is a fun one. I actually think we're pretty on the same page on this topic. So the question is So Daenerys is a small dog, and then we were talking a little bit about that big dog. So how do you know when is the best time to spay these dogs? And my opinion, honestly, has changed a ton. So I graduated from vet school 6 years ago. You're 4 or you 5?
I think 6 as well.
Oh, where's high five, 2012. Yeah, you just kind of block it out, like it happened, and you know that you're a veterinarian, but you don't go back there. So for me, my mentality's changed a ton from when I graduated to now, and I think it's changed a lot too based on what I see in clinical practice. Like, I love big working dogs, shepherds, and things like that they make my heart sing. All breeds do, but that's kind of my personal area that I know the most about. So for small dogs, we're typically saying bone development's ending around 6 to 9 months, depending on the frame, where those bones are pretty much at their full length and they're done growing and the growth plate starts to close. So we're saying, at 6 to 9 months, I'm okay spaying those dogs. Sometimes I'll do it as young as 6 to 7 months, just depending on the breed and the temperament and if there are other considerations. And the reason why I'm kind of saying that is one of the things that we've learned is that when we spay or neuter big dogs or dogs that aren't done growing, so those puppies that are 4 weeks old, they tend to get way bigger than they would because their growth plates don't close as they would have. So
Agree. I think for larger breed dogs, we want to wait, if we can, till probably 12 to 14 months, more toward the 14 for the giant breeds. And because we want those growth plates to close right when they should, for those bones to develop right like they should. And for small dogs, I agree. I would say, by 10 months for sure, they're about as big as they're going to get. So it really depends on the dog. There are some dogs that have, say, a really small vulva that might be kind of recessed, and that might cause the dog problems throughout their life. So if they have that, we want to let them maybe even go through a heat cycle so that develops a little bit, comes out, reduces problems in the future, and then spay them after that. So that's kind of the other consideration she was talking about. You have to take it kind of in what are we going to be doing with this dog? What is our goals for them? What is their body type and all of that? So there's a lot of different factors that just really varies. But I agree with Dr. Lindsay. I think as more data comes out, we're realizing there may be benefits to waiting a little bit longer. The risks are that you have to really watch them when they're having those heat cycles because they're at risk for getting bred without you knowing about it. And it's just the truth because those male dogs will smell them 1.5 miles away and they will do whatever it takes. So never leave them alone when they're having a heat cycle. Make sure that you're protecting them during that. But if you can do that, we can go through 1 or 2 heat cycles if we need to try to get those other benefits. Growth plates and hormones do go hand in hand. Correct. So, and with boys, we can even wait a little bit longer because we don't have to worry about those heat cycles causing any of these mammary tumor issues. So for them, we can wait till that 12 to 14 months, regardless, give them that little bit of extra time to grow and develop, and they're still going to have the same benefits whether we neuter them at, 8 months versus 12 months.
This factor, this obesity factor, with the spaying and neutering the animals. I had a dog that I waited till 6, and he stayed really fit and muscled, and that's why when we discussed this, I said, what really is the risk factor? Is it after 6, when they become seniors, that they're have a more propensity to cancer? And if so, I'd rather have them go to 6 and maintain their adequate weight instead of getting so fat. Because it's the dickens to get the weight off of them once they're neutered, and their metabolism seems to slow so drastically that you're dealing with weight problems again.
And I think that is one of the most challenging things after we spay and neuter pets is we tend to see a rise of obesity. So this is something with a lot of owners that I'll talk about even combating before we start. So if we're starting to get ready to think about spaying or neutering a pet, I'm already talking to owners and saying, let's transition to an adult food if your pet is done with the majority of their bone growth. Let's start to think about what are we going to do? How are we going to adjust our energy and activity expenditure, and then how much this pet is eating to make sure after their metabolism slows down when they're spayed or neutered that we don't see this rise in weight. And probably one of the biggest challenges that we see day to day, and it's common in humans too. I mean, I think weight management is really difficult, and it varies depending on the pet too.
Yeah, I would probably just add that we say in a roundabout way about 20% less calories after they're spayed or neutered. Just start that right away. And then as you're feeling them every day, if you feel they're starting to get that little bit of extra chunk, go ahead and cut that food down a little bit more. Maybe they're not being as active during the winter. If they're not as active, they don't need as many calories. And so it's our job to really, I would get out a measuring, level it off. For these small dogs, even if you have a little bit of a heap to your cup, that's going to cause them to gain weight. So you just have to really watch your pet as you go, feel on them, and vary that food amount as you go to make sure that they stay that nice healthy weight. Green beans, a little bit of pumpkin to help them feel full. Those are great strategies for helping to maintain that low weight.
For larger dogs, does spaying too early, where the bone plates have not solidified, contribute to later osteosarcoma?
So is there a link? So that is not, I don't know a direct correlation between early spay and then also an increased risk of osteosarcoma. I would say hip dysplasia, elbow dysplasias, osteoarthritis. Yes, I think we know a nice correlation.
I think there's some preliminary evidence that there is an increased risk of bone cancer in dogs that have been spayed or neutered early. I don't know that that's huge increased risk, but there are some preliminary studies that suggest that.
We're talking with these early neuters, pediatric neuters typically, so things that are
even smaller. So we're talking about the shelter dogs that
like
are, at the month mark, the 2-month mark.
Yeah, those like 6 weeks or so. And every spay and neuter decision is so individual based on that specific pet, that specific owner. That's why it's really good. And Cheryl and I had this talk for her handsome Noah. So she has a gorgeous golden retriever that we recently neutered. But when is the very best time to do that? And that's where we talk together and we find out what is the best based on, these are the things I'm worried about. And then you find a nice area where you're comfortable with. But that answer is so different depending who you talk to and depending what the goal is for your pet and what your risks and what your concerns are. If you have a pet that's had a certain type of cancer and that was traumatic for you, you may say, I never want a dog with breast cancer, but again, I will neuter or spay them whenever. So it's very individual. That's fun. Oh, I love all the questions, you guys. Gets me thinking. All right. So this is unfortunately another very common type of cancer. So this is called hemangiosarcoma. This is one that I tend to think a lot about in my larger breed dogs. The golden retrievers, unfortunately, this is quite common. This is a very aggressive and that metastatic word, so it loves to go places. And the hard part about this one is most of the time, by the time we find it, it's already went somewhere else because it's a blood, so it forms from the vessels that form the blood vessels, so the cells that form the blood vessels. It most commonly forms in the spleen, the heart, and the subcutaneous tissues and skin. The skin type is very different from the very aggressive internal type. The skin type we see a lot in our white dogs. I think that white boxer that loves to sunbathe with his belly out, that's the dog that I think about for this. But the other types, those scarier types where it's going to their spleen, it's going to their heart, I think about my Goldens, I think about my Shepherds. How do we diagnose these? So typically these are diagnosed with blood work and imaging. The exception is those ones that happen in the skin. Those are typically done by biopsy because usually when you aspirate those, all you see is blood because it's a blood vessel. It's a cancer of a blood vessel. How do you treat this? This is a really challenging one for me. The skin ones, you take them off and those ones do great. These ones that go to the other organs, so that go to the spleen, that go to the heart, these are harder to treat. Many times we are taking out these pup spleens or we're draining the fluid and things, but this one doesn't give us as much time to act. Sometimes with routine, so I had a little dachshund that was 9 years old that again was one of my kind of earlier on at the animal care center, had some changes in routine blood work, was going to get a dental cleaning, and so we did an ultrasound, found a tiny little mass on his spleen. So I took out his spleen, sent it to the pathologist, and it came back as hemangiosarcoma. So in some of those where we catch them quite early, this doesn't happen as commonly as I would like, he actually went and he got some chemotherapy. But the earlier you catch these, the more options you have and the more time you get.
For those golden owners, Dr. Lindsay, what are they likely to see if their dog has this?
So it depends on where this lump comes from. So if the mass is forming in the spleen, those goldens, sometimes they can have a round belly. They can be really pale when you look at their gums. They can have a hard time breathing where they just can't catch their breath, or they're just having a really hard time getting any energy at all. I think energy loss is honestly one of the most common ones that I've seen. Or even episodes of collapse where the dog will try to do something and then just fall.
Yeah, I just say that because my golden had this type of cancer. I'm a veterinarian. I know exactly what to look for. I didn't see this cancer until he had a huge bleed. He was flat out on the floor, pale as can be. We rushed him to the emergency facility. It can be a nasty one, and Goldens in particular, really common for them. So it's one that you may not notice any signs, even knowing everything to watch for. So, if you see them like that, you want to get them screened. Goldens, once they're 7, 8 years old, you always want to be looking for this. That's why that imaging, like the x-rays, is so important for especially those breeds that are predisposed to this type of tumor.
All right. And this is the last type of cancer that we're going to talk about again. So this is another big dog type of cancer. It can happen to anybody. It just unfortunately happens a little bit more commonly in our large breed dogs and our giant breed dogs. The kind of breed that came to mind when I really think about this tumor is a Rottweiler. Their breed, we don't know why, has an 8 times increased risk over any other breed to get this type of cancer. And it's the most type of bone cancer that we see. So these dogs can present really interesting. You don't always see something super obvious like this big swollen spot on the leg. Sometimes it's just a limp that won't go away. How many of your senior dogs, so who's got seniors again? How many of your dogs take pain medicine for arthritis? Mine does. How many times has your senior overdid it and then you gave him a Rimadyl and you're like, oh, we'll see how he is tomorrow? I do it all the time. I do it all the time. So if you have a limp that is just not improving with pain medications or going away, we need to check that out. We need to take some x-rays because sometimes it's not just what meets the eye. Sometimes it's not arthritis. And typically this is diagnosed with palpation. So these dogs are so painful. The bone actually has the second the second highest number of nerve endings in the whole body. So number 1 is your cornea, so your eyeball. Bone is number 2. And so these dogs are really painful when you feel these spots on their legs. And then they also, when we take x-rays, get this really scary looking x-ray. So if you can kind of see towards the top, that bone looks really nice and is nice and bright white. And you see that big swollen area where the bone looks moth-eaten. It looks like something chewed away a lot of that bone structure. That's what these tumors look like on a regular basis. These ones, again, are a little bit of a scarier one. These are ones that many times by the time that we know that they're there, they like to go to other places. They unfortunately like to go to the lungs. And these treatments, these sound really drastic. So these are surgical. And these are surgical to the point that we talk about taking off a leg. That's how aggressive these types of cancer are. And many of these dogs too afterwards will get chemotherapy because we are worried by the time we knew something was wrong that it's went somewhere else. And we're trying to slow that process down. It does. A very high likelihood of going somewhere else. But there's actually, so this is kind of the part that I think is really fun. So there's a new type of, it's called an osteosarcoma vaccine. It's not really a vaccine, it's more immunotherapy, but this is one of those latest and greatest. There are new trials out there that different veterinary oncologists are developing to try to get a better cure rate or a better management strategy for osteosarcoma. And my last kiddo that actually got this vaccine, he survived twice as long as he was originally estimated with surgery and chemotherapy alone. He actually was euthanized for a different problem. So his cancer was in his front shoulder. And so they removed his leg, but then he unfortunately blew out his knee, poor guy. So, you know, he actually survived much longer. But there's new treatment options that come out every day, which is the best part about canine cancer, is that we're finding better ways to treat it all the time. All right, we're just gonna very briefly touch on a few treatment options. We've talked a lot about surgery, but I kind of wanted to myth bust a few things with chemotherapy, because who hears the word chemotherapy and gets a little nervous? Who knows a family member that's had chemotherapy? Okay, I want you to take all that, throw it away. Just seriously, throw it away. It's very, very different. Dogs actually respond, so they tolerate chemo better than humans. 80% of dogs are going to have minimal to no side effects. About 15% are going to have mild side effects that we can control with medications, and less than 5% are going to have a severe side effect to their chemotherapy. That's incredible. That never happens in human chemotherapy. Typically, the side effects that you see are going to affect the GI tract. So it's going to be upset tummy, changes in appetite, some diarrhea. Diarrhea is actually probably the biggest one that I see, and vomiting in my kitties. Blood work is done a lot of times for monitoring. So blood work is typically done before chemotherapy is given, and then multiple times throughout the chemotherapy process to try to make sure that we're using the right dose of chemotherapy. But the great news is many times it's done outpatient. So many of these dogs get their chemo, and then they go home the same day. I actually have a few owners that do what's called metronomic chemotherapy, which is oral chemotherapy that's given to try to slow cancer down. It's not going to cure cancer, but we're just trying to take things and slow it all down. I have owners that give their dogs chemotherapy once a day. I have kitties that do once a week. That depends based on the type of cancer and how we're using the chemotherapy. But there's a lot of different options. Again, a very patient-specific, owner-specific, because I have many owners that say, I don't want to do an injection, but I'll do a pill. I could do that. Or others that say, you know, I don't want any side effects. So then we're going to talk about some of our medications that we tend to see less side effects and things like that. But there are a lot of different options out there. And then I just very briefly wanted to touch on radiation. Radiation is not as commonly used in veterinary medicine. For us, for primary beam radiation, the closest that we have is Colorado State's Veterinary School. We have a local practitioner that does what's called brachytherapy, which is focused radiation. That still is in the very trial stages of canine cancer, so we're learning more about it each case that he does, but he's actually kind of one of the only people really doing it in the whole country, so I'm excited to hear as he's seeing more cases and things, because I love to have an option closer to home. But this is very similar to human medicine, so individualized treatments where we're applying that radiation directly to the tumor and the surrounding cells, trying to stop that division. Most of the time, these dogs do quite well. One of the biggest things that these dogs that I've had owners tell me is afterwards some of the dogs are a little bit more tired. It feels like, for humans, what they say, it's like a day of being at the beach. You didn't do anything, but you're just tired from being in the sun, things like that. And then lastly, skin irritation. So I see a lot of what's called a radiation burn or a skin irritation secondary to radiation. Has anyone, huh?
Hair loss, coat loss?
So not actually as common in dogs and cats, even with chemotherapy. That's a really big question that I get asked a lot is my dog's fur gonna fall out? The biggest exception to that is because dogs don't shed their fur, they don't grow their hair all the time. They go through periods of hair growth. The exception are our dogs that are always growing fur, so our poodles and some of our sheep dogs, things like that. Those dogs can lose hair, but for the most part, what we actually see is a discoloration of the fur. So this fur, maybe the cat is black, the area where they did radiation is now brown. So that's more common than anything, and that's actually common in chemotherapy too. I got a little black kitten that I treat for GI lymphoma that she used to be really black, and now she's black with a little bit of brown on the tips of her fur. Any other questions about chemotherapy and radiation? Because these are scary words, and I think the more we know about them, the less scary they are.
It is scary.
Mm-hmm.
Did you say Colorado was the closest?
For the primary beam, yes. All right, and then there are a lot of really nice research, nice places to go. There are a lot of support groups out there for pets with cancer. I just wanted to very briefly, before I end, I was excited that Dr. Steph was able to make it because Dr. Steph is one of the founders of our hospice program. There are some times where no matter what we do, no matter what we try, cancer doesn't play fair. And unfortunately, things don't go the way that we had hoped. But I want you to know that we have options for you. It doesn't have to be the end. We can talk about how we can support these pets, even if we say, I'm not going forward with treatment anymore, but I want my pet to be comfortable. And that's where I'd love Dr. Steph to kind of pop in.
Yeah, just a short word about that. So when we get to there's nothing more we can do, there's still tons we can do. So when these pets are still feeling good, even if we've decided that, hey, cure isn't really an option for us, or that's not our goal for this case, we want to make sure that this pet is going to be comfortable. And to do that, we want to make sure that we're thinking about, pre-treating things like nausea, really making sure we're comprehensive about their pain control, talking you guys through those grief feelings that you're feeling, providing resources for you to get somebody to talk to if you need to, and then helping you evaluate quality of life, because that is the biggest, hard part of owning a dog, is getting to that point and saying, I can't make this decision. You see them every day, they look the same to you. If you're looking at them serially over time, though, someone from the outside may be able to help you really be more objective about it and help you make that decision and feel comfortable with it. And we do a lot of care inside the home, so you don't have to drag them into us all the time. We're going to come to you. We're going to look at your environment. We're going to tell you, how can you help your pet get around better? How can we make these last, months or weeks or whatever it is that you have together just the best possible time? My own dog, like I said, died of hemangiosarcoma. We went and got him the surgery, and then for that month afterwards, we just lived it up. And knowing everything that I know about hospice care, he was on great pain meds. He acted 2 years younger. He was running around playing like I haven't ever seen him. And so we can, in a lot of cases, make that happen. Not just give you quantity of time, but give you quality of time that the pet enjoys with you, that you can enjoy that bond and have time to come to, the conclusion that they need to pass. So that's what we're here to do. I'm super passionate about it, if you couldn't tell. If you get to that point, there's still options. There's still things we can do. There's never no hope. We always have something.
And hospice doesn't mean that we have to stop with treatment. hospice, we can keep doing, say we're on a long-term chemotherapy plan, we can do these things simultaneously. It's never too early to start thinking about hospice, particularly if your pet is diagnosed with a disease that will most likely cause their death at some point in their life. We may not know when that will be, but we work together, and I mean many of us, so we have technicians, we have veterinarians that are all part of this team that work together to make sure that we're taking the very best possible care for your pet in the way that you want it done. And I think that's a really important part, because there's no one treatment that is best for every pet. It's a very individual decision, and it's going to vary, you know, based on each dog. Some dogs are going to some dogs, they don't care. You can give them pills, they have stomachs of steel. We have some others that, you know, the idea of giving medications to every day would maybe even be more traumatic than not. So that's where we just have a really open and honest discussion with each other as a veterinarian, as a pet owner, on how we can help each other. Okay. All right, so this was really fun, guys. I loved this lecture today. Does anyone have any questions or other things that maybe I didn't go over in my presentation that you'd love to chat about with the group? Otherwise, I will be mingling for a while as we're kind of tearing down and things. If you have any concerns, please come find me, come find Dr. Steph. We have a lot of our technician and support staff team in the back as well. I hope that you can all say hi, and thank you all so much for coming. Okay, thanks. And we'll be back next month.